Why Medicaid is important and why it isn't enough. Brought to you by Whole Washington for Universal Healthcare, Washington State. Why is Medicaid important? It covers the most needy. In Washington, around 1 in 5 people receive benefits from Medicaid, which is about the same as it is nationally. Medicaid accounts for $1 in 5 spent on healthcare. And Medicaid is especially prevalent in long-term care, which accounts for about 60% of total spending. Medicaid is the key source for particular populations, children, particularly low-income children, non-elderly adults with low income, and people with disabilities. This chart shows the people on the left who are eligible and receive benefits from Medicaid. Children are the largest percentage. However, if you look at the spending, people with disability and eligible individuals who are 65 or older take up about half of the total spending, despite being only 23% of the whole. So children are relatively cheap to take care of on Medicaid, and that's because younger people tend to be healthier. If you remember one thing from this video, remember Medicaid is for the children. Reason number one for why Medicaid isn't enough. Reimbursements are too low. What are reimbursement rates? Reimbursement rates are what Medicaid pays to your provider for services, medication, or procedures. If we look at the payouts for Medicare versus Medicaid to providers, we can see that Medicaid pays significantly less for services, about 70% of what Medicare pays. This leads to fewer places accepting Medicaid as compared to Medicare. And in Washington, we can see very similar, although we allow more for reproductive care than the national average. If we look at Medicare, we can see that only 1.2% of physicians have opted out. And in Washington State, our opt-out rate is slightly higher at 1.7%. However, if you look at the opt-out rates for Medicaid as compared to private insurance, we can see that Medicaid gets significantly lower acceptance rates. So that means 26% of places where a person goes for medical treatment will not accept Medicaid. In Washington, we have a higher rate of our providers accepting Medicaid. Medicaid does not prevent underinsurance. So what is underinsurance? Underinsurance is when insurance is so unaffordable that we see a significant increase in avoidance of medical checkups, obtaining medicine, getting treatments, getting checkups. Out-of-pocket and deductibles reach a certain percentage, and this qualifies people for this. It's usually between 5 and 10% of household income. The first evidence for Medicaid not being enough is that during Medicaid expansion, which started in 2014, it did not have a significant impact on the rates of underinsurance. So in the non-expansion states and in the expansion states, we saw similar declines in underinsurance. Additionally, even today, we still see a large percentage of people who are underinsured. That's 23%. 16% of those who are underinsured have Medicaid. Now, a lion's share, 2/3, have private insurance, but there's still 8 million people, or about 1 in 9 people on Medicaid, are underinsured, meaning they're paying too much out of pocket for their medical treatment. And the good news is Medicaid has half the national average. There's also looming Medicaid cuts that could impact millions of Americans. 72 million people, or about 1 in 5 Americans, is on Medicaid. And if Medicaid is cut, we'll see millions of people losing their health insurance. So what's the solution in Washington State? The Washington Health Trust is a Medicare for All light at the state level that would provide to all Washington State residents comprehensive coverage of medical, dental, vision, hearing, mental health, and reproductive care. There would be no deductibles, no copays, no networks, no denials, no bills, and zero out-of-pocket spending. Want to help universal healthcare succeed in Washington? Check us out at wholewashington.org.